All right. Sorry, I have kids in the background, but assalamu alaikum everyone for coming. I wanted to thank everyone for coming on behalf of Mainline Muslim Society. This is something that we have just started this month. We want to do a personal enrichment event for the community monthly. We are going to focus on healthcare, especially COVID this month. And then inshallah, we are planning on going into diet and exercise, especially with COVID, everyone's sitting at home in the next 2 months. We also have some other exciting things planned. So hope you guys can be a part of all of that. If you do have any questions or want to be part of this personal enrichment exercise and be part of the team that's putting all this together in the next year, please just send us a message on here or email us at info@mainlinemuslimsociety.org, and we'll get back to you. We'd love to have more people involved to help us out. Of course, this feedback is appreciated from all of you at any time. We will have a poll at the end that you guys are welcome to fill out, or you can even email us. We wanted to also mention that we do have a family guide that we've made that we'll send to everyone who's registered after we're done, and you're welcome to share it with everyone you want, and let us have some feedback on that too if you have any questions. Throughout this event, Amri, who's going to take over in a few minutes, will talk about questions that you guys may have. You're welcome to put them in the question box, and we'll have them answered, inshallah, for you. And finally, one other thing is, at the Mainline Muslim Society, we're very interested in helping our community members, whether you're part of the Mainline Muslim Society or not. So we are going to have an email hotline in which you guys can email us questions that you may have regarding COVID or regarding anything else you may need help with your friends and family, and we'll try our best to help you, guide you, and answer your questions. So without delaying any further, I'm going to hand it over to Brother Amri, who's going to continue with the session, inshallah.
Thank you, Dr. Sheikh. Assalamu alaikum, everyone. I'm Amri. I'm from Baltimore, Maryland, currently a third year student at Jefferson Medical College in Philadelphia. Although I'm not from near the Bryn Mawr community, I thought that, when I heard about these talks, I thought it was a great opportunity to bridge the gap between, healthcare providers and the community. So inshallah, with this initiative, we can, promote healthy lifestyles among Muslims and hopefully, inshallah, be more conscious of our health as a community. So today our talk is about something that's obviously very pertinent in the world right now, and COVID-19. And with the surge in cases and deaths in the past month, there's so many questions about, how can we protect ourselves and how we can protect our loved ones when we're leaving the house, when we're going to work, etc. So tonight we're grateful to have somebody who is a doctor and hoping to specialize in the field of infectious disease and treating diseases like COVID-19. So hopefully, inshallah, we can clarify some misconceptions about the illness and answer some of your questions. As Dr. Sheikh said, we'll also send out a flyer afterwards with some take-home points, and feel free to use the chat box to post your questions throughout the talk. So without further ado, I want to introduce our speaker, who are very thankful to join us today. So Dr. Subtain Zia was born in Lahore, Pakistan. His parents migrated to Connecticut, where he went to school and then earned his bachelor's degree in biological sciences at the University of Connecticut. He attended medical school at the Philadelphia College of Osteopathic Medicine in Philadelphia. He graduated in 2018 and went back to the University of Connecticut for his internal medicine training. He is currently in his final year of training. He will be starting his training in infectious diseases at the University of Massachusetts in June 2021, inshallah. Subtain is the youngest of 3 siblings and just got married in September in Massachusetts, actually. So congrats to him. And So without further ado, Subtain, if you want to, I know you have slides, if you want to share your screen.
Thank you so much, Omri. So thank you everyone for being here. I try to keep it as pertinent as possible. And this is pretty much up to date as of today. So this is more focused on us as Muslims and the time that we're living in right now. So without further ado, let's dive into it. So just to give some background, how does it spread? So usually it spreads through respiratory droplets, right? When you sneeze, when you talk, when you're coughing, singing, breathing, you have all these droplets coming out that you obviously can't see. And sometimes they can land on, let's say, a surface, on a countertop, on a table, and then you touch those surfaces. And the next thing, I have a bad habit myself where I'm itching my beard sometimes, and that's how these particles, the virus can get into your mucous membranes and then go into your lungs and cause the infection. And another aspect is that some of our family relatives might use like a CPAP machine at night for something like obstructive sleep apnea, for example. And that can kind of aerosolize the virus if they have it, where you have different size particles. And some may just linger around in the air for hours. So we have to be aware of that. And up to 50% of the people, they may not even know that they have the virus. So basically, incubation period is within 2 to 14 days after exposure. And you may have fevers, you may have chills, muscle aches, vomiting, diarrhea, loss of taste or smell, cough, and obviously shortness of breath. And then, so how are we preventing this as of right now? Obviously, I know we're all wearing masks, right, when we go out. So anybody over the age of 2 should be wearing a mask. There are a few exceptions. So people who have trouble breathing, and that's kind of like more on the fringe aspect. Usually masks should not cause any issues with oxygenation or buildup of carbon dioxide. So most people should be able to wear a mask. And you may have seen people wearing cloth masks. And as far as they're double layered, they can actually block 50 to 70% of the droplets that may be hovering around. And as of November 10th, CDC also stated that people who wear masks also protects them as well. So like I said, people who shouldn't wear masks, so children younger than 2 years of age, anybody who has trouble breathing, or obviously if they're incapacitated or unconscious. And then you may see some masks with like these small like vents, like circular vents. So those are not good, and I'll show you some pictures next, because you can have actually like droplets just coming out of that. So like I said, people who may be hard of hearing, they can obviously have some trouble. So there are masks with the clear film, or you can also use like a pen or paper to communicate with them. Younger children, obviously runners, depends on occupation that you're in. So the types of masks. We talked about the 2 layers. Make sure it's on your nose and on your mouth. I see a lot of times when, and sometimes the masks slide down too, is that people just have it on their mouths, but you're obviously breathing through your nose, and you're still spreading it if you have it. And then make sure it's like a snug fit. So, masks made of vinyl or with those like small little like caps. And then in terms of N95s, which healthcare workers are usually wearing that mask. So we have to conserve those mostly for healthcare workers. And also if you have a beard like I do, it's not effective because you can have particles come in and actually get out as well. Special situations we talked about, younger than 2. A lot of companies are making like smaller masks for children. So make sure they're like tightly fitted. And then someone who wears glasses often runs into this with the fogging. And the one thing that you can do is you can kind of like shape it along the ridge of your nose. And that way it usually wouldn't fog up as much. And I kind of move my glasses up a little bit over the mask. And as the picture's worth 1,000 words, you shouldn't be wearing a mask like any any of these people are in this picture, and definitely not on your arm. And how to take the mask off. So fold it in half and keep the inside part out. Now, that's also like, it depends on where you're putting the mask. Some people do have a Ziploc bag where they can put it in, because if you put it in your bag or if you put it on a table, there's a risk then you're putting it back on your mouth. So there's always a risk of that. So just be careful as to how you're using the masks. And so face shields. I've seen a lot of face shields in NFL, and we obviously wear face shields in the hospital. So there's no good data as of right now. And CDC is looking into as to how much the face shields block. Obviously, you have to clean them before and after using, because when you're talking, your droplets are landing on that face shield. And then also the gaiters I've seen in like football games as well. So there's still data pending on how effective they are. So prevention, right? We all know this. Stay 6 feet apart, try to socially distant, and wash your hands for at least 20 seconds. And use any of the sanitizers more than 60% alcohol. And then you can also use gloves. When you're taking care of the sick. One thing that I saw at the beginning of the pandemic, especially in like grocery stores, that people had a lot of surgical gloves. And the problem with that is that you're going to touch the cart, you're going to touch your phone, you're going to touch your wallet. So that's actually spreading germs now. So for CDC, you can just wash your hands, and you can use the hand sanitizer. It's just as good. Also, you can send maybe perhaps the healthier members of your family to shop for you, and that decreases your risk. And obviously, if you're sick, like try to stay home as much as you can. So this is just a picture here, recapping everything that I talked about. Cover your cough. Like you can usually use like the inside of your elbow, and that way you can protect all the sneeze from spreading like all over the place. And then obviously wash your hands, and as Muslims we do that anyways, but do it at least for 20 seconds with the soap. So this is the key here. And as of today, and these guidelines kind of came into action at the end of last week. So previously you must have heard about the 14 days quarantine, right? If you come into contact with somebody. So CDC changed that, and now it's 10 days without testing, or 7 days if you have a negative test after 5 days, and then watch your symptoms for at least 14 days. So the caveat is that CDC still recommends 14 days of quarantining, and there's still this possibility of transmitting the virus. So it's more out of convenience because of the number of days people are out of workforce. And that's my overall understanding of the revision of these guidelines. I still think it should be 14 days, but these are the updated guidelines from CDC as of today. And obviously, if you're exposed, then, hydrate yourself, rest, and get tested, contact your provider, and they should be able to get you tested. One thing is that CVS does these rapid tests, CVS or any of these pharmacies, but those are antigen-based testing, and there's a little bit of a difference where even if they're negative, doesn't mean that you don't have it. And we can go more into that later. And make sure you're quarantining in the interim. So 10 days or 7 days with a negative test after 5 days. And so the vaccine updates, I know we've heard quite a bit. So these are the 5 front runners as of right now. So phase 1A is going to be the healthcare workers and the long-term facility residents, like in nursing homes and so forth. And you can follow the data on individual vaccines. I won't bore you as to the mechanism of each vaccine, but the data that's come out as of right now on, let's say, Moderna, it protects you 94.5%, and Pfizer is at 95%. And AstraZeneca, if you give 1 dose followed by half a dose, it's 90%, But if you give one full dose followed by an other full dose, it's 60%, which is odd. So you guys must have heard today that in UK they've started vaccinating people with Pfizer's vaccine. So it's most of these vaccines are a two-part series. So you're going to have one vaccine followed by another vaccine in about 28 days. So that's where we are with the vaccines. And then how does this affect us as Muslims? So obviously with the wudu, you go in, you have to take your mask off, and then you have to wash your face. So make sure that, you know, whichever mosque you go to is that there's adequate distance and there's not too many people congregating in the same place. And also after washing your face, put your mask on, but make sure it's dry. And then stay 6 feet apart. Obviously maintain adequate ventilation, which is going to be hard in the winter because on Fridays when I was going to my masjid, we were kind of like in this basketball court and we were all sitting 6 feet apart. Other than that, hand sanitizer stations are at more masjids. Another aspect that's really affected is, you know, weddings, funerals, Eid, Hajj, Ramadan. And then also follow your local guidelines because we don't have a national mandate. It's all dependent on your local Department of Public Health. And in terms of traveling, so this study came out in October, and basically, long story short, it's like they concluded that it was low risk, but not no risk. So don't travel unless you really have to. I know in my family, people are trying to travel, and I kind of have to talk them out of it. So there's absolutely no point in traveling right now if you can avoid it. And the other thing is the study was kind of sponsored by a consortium of aviation industry, you know, airport operators and manufacturers and operators and so forth. So big takeaway points. Also, don't forget about your flu shot. Like influenza still exists. I know like Corona's kind of taken over everything. And then to recap, everyone over the age of 2, with some exceptions that I mentioned earlier, don't use a mask that's soiled, obviously. Face shields we talked about. Avoid touching your eyes, nose, and throat because that's how the virus is going to get in. And wash your hands for at least 20 seconds. If you're sick, stay home, get tested, which may be negative in the early stages of the disease within like 48 hours or so. And then the quarantine, just to recap, 10 days without getting tested now, and 7 days with a negative test after 5 days. But CDC still says 14 days because you can still transfer the virus. And this is a very important point about steroids, that a lot of PCPs, when you call them, they may give you steroids, and that can actually make it worse because in the first 48 hours, you're shedding a lot of virus, and that can prolong the shedding of that virus over the next few days. And that's something that you don't want because it can make you actually worse. So we are using steroids in patients who are on oxygen, but not before that. And my references, you know, CDC and NIH. And I wanted to keep it pertinent. I wanted to keep it brief so that you guys have time to ask for questions and that I'm not drowning you in a lot of details. So thank you so much for your time once again. Please stay safe.
Jazakallah khair. That was a beautiful, quick discussion on this. There are a few questions that were coming up. If you can shed some light on them. When do you think, you may not have the answer to this, but when do you think masajids can start their operations? What are your thoughts on you know, prayer and things like that?
So like I said, it has to be based on your local Department of Public Health. I know in Connecticut that houses of worships, the capacity was cut down by 25%. If you can do a lot of congregation over Zoom, I think that's better than trying to bring in people in one place without knowing their exposure in the community. So it has to be up to the management of the masjid and so forth.
Okay, and there's some talks about some pill being developed related to COVID and COVID vaccination. Do you have any information on that?
I am not aware of a pill format,
Okay,
unfortunately.
okay. And then some questions about vaccines. Do you think the vaccines cover more than one strain of the virus? As there are reports of different strains, will it help everyone?
So the one thing that we've noticed in the past 9 months, give or take, is that the virus hasn't really mutated as much. And if you heard about SARS and MERS that was in Saudi Arabia a few years back, that's kind of a similar family of coronavirus. So this is a different strain of the coronavirus family. So ideally, the vaccines that are coming out should protect you.
Okay. And one question was on COVID-19 virus. How long does it last if it touches fabric or cardboard? Should we disinfect packages in the mail or items from the grocery store? That's a good question.
So there's been conflicting data. At the beginning, they were saying 72 hours, and then they're saying 5 hours and 8 hours. I think it only honestly comes down to not touching your face and not touching your nose and mouth. And you should be okay. Just make sure that you're washing your hands multiple times a day. And that's what I do when I come home. And even when I'm outside, I have like a hand sanitizer in my car. So when I get in my car, even before I turn on the car, I wash my hands. I'm sorry, I sanitize my hands.
Do you, so a question more directed to you. You don't have to directly answer, but would you take the vaccine right now? Or what are your thoughts? Like, should the public be taking, I know right now it's going to the healthcare workers, but
Right.
what is your opinion on it?
So Connecticut is going to get vaccines in the middle of December. So it's December 8th today. So in a week or so. And we were told that we would be the first in line to get the vaccine. I think for me, it depends on which vaccine it is, whether it's AstraZeneca or whether it's Pfizer, Moderna, or Johnson & Johnson, to be honest. I would get the vaccination depending on the safety data, and FDA today reviewed the data from the Pfizer vaccine. And I believe next week they're reviewing the data from Moderna.
Okay, great. Another thing was, I believe that 80% of the population must be vaccinated for it to be effective and return life to normal. What if we don't reach 80%, especially if people refuse to take the vaccine? What will that mean for infection rates and our chances to return to normal?
Right. So you can achieve herd immunity at 68%. And once you have that, then ideally, you shouldn't get, and that's something we see with measles. There's a lot of parents who don't want their children to be vaccinated. So it's hard to predict. There's always going to be people who are going to refuse the vaccine. The one thing that you may see with these vaccines is that they're first generation, and usually with a flu shot, your shoulder may be a little bit sore. With these vaccines, you may be a little bit more sicker at the beginning. It's hard to say. We don't have that data yet.
And then how do we get to choose which vaccine we get? Because there are a few coming out. Do the PCP choose this, or what happens?
So it's the contract that our government made with these pharmaceuticals. So usually I think it'll come down to the formulary that's available around you, but you should be able to choose. Like if you go to CVS, just like a flu shot, there's different kind of the manufacturers for the flu shot. So you should have that option to choose. And with the news being all around us, you should have enough information on the vaccine that you're going to get.
Okay, that's helpful to know. One question I have for myself, one of my friends, he called me because a few people in his family were sick, household members. They got sick at different times. He was asking whether he needs to wear a mask around them. He's the one who because of him, the other two members got sick, and he is towards the tail end. And he was asking whether he needs to wear a mask around them and whether they can kind of get each other more sicker by being close to each other.
So the virus itself sheds for about 48 hours. And after 10 days or so, if you're symptom free, you're not having any cough, you should be able to end your quarantine. And that's something that we're even doing in the hospital now, where we take off precautions after 10 days. So any patient admitted to the hospital initially has precautions where, we wear everything, the mask, the gown, gloves, everything. But after 10 days, we are taking them off now. So I think 10 days is a good time. Unless you're still having symptoms, then you should wear your mask.
Sounds good. I'm getting more questions. Are you okay with a few more questions?
Yeah, absolutely.
Okay. For COVID on fabric or store-bought items, is it safe to handle them and then simply wash your hands afterwards, or should we disinfect the items when we bring them home?
So, I got mail today, and I just wash my hand usually. So if it's being transmitted to you, if it's being delivered to you, FedEx, UPS, whatever, the virus is not going to survive for that long on surfaces. That was the recent data that came out about a couple of months ago. So it's up to your preference. In terms of clothing, you can wash it if you feel like it. It's more of a personal opinion, to be honest. I don't think that you would get COVID from wearing clothing, especially like if you just bought it. But you can always wash it first. But the key is not to touch your face.
Okay, so pretty much it's data. It's still not completely sure exactly, so got to be careful as you can be. Okay. Do you think there'll be mandate children to get vaccines before the next school year starts?
So in this initial phase, they actually don't want to vaccinate children.
Makes sense. They want more data.
So we have to look at data first on adults who get the vaccine.
Okay. I'm not seeing any other questions yet. Amri, I don't know if you had any other questions.
No, I don't have any, but if anybody has any questions, feel free to post in the chat or even unmute yourself and ask directly.
I had a comment.
Go ahead.
I just want to say I really appreciate the time for you to set this up. There's a lot of mixed information coming out there, even amongst physicians, people in the medical field. One person says one thing, one person says the other. So I really appreciate the fact that you said, a recent study came out, or this just came out last week. I can't tell you how important that is that we're getting, fresh and new information. I'm the guilty party here, asking about disinfecting every item that comes from the grocery store, or disinfecting the items that come in the mail. But I really appreciate that you clarify that there's been new information out there as far as the virus being on clothing or on a package they get in the mail. So I really appreciate that. Thank you.
Appreciate that, Irfan, for that comment. I think there was, for some reason, I think when people are messaging, it's only coming to me as the host. I don't know why. One question was, can you get COVID again?
Yes.
That was an easy answer.
I guess sorry, I was just going to ask a question that I had. So, you hear a lot about, if you get COVID, you develop antibodies and you'd be less prone to getting reinfected. But now more and more you're hearing about stories about people getting, this is like their second or third time getting COVID. So I just want to know what the verdict is on reinfection.
So the cases are low, but it depends on your immunity. If your fighting cells in your body, if they're not lasting for a long time, and in a lot of cases they're not, then you're prone to getting reinfection. And we've had cases in our hospital where somebody was infected in March, and then they got reinfected. But it's on the lower end. A lot of people are getting now exposed just because of the community incidence being so high.
One question is about teaming up with another family during quarantine. Is that allowed? Is that okay to do? If two families are sick or they're not sick and they just live together?
So
Nicole?
I elaborate. So quarantining, it's this catchphrase where you pick a family and you only see each other. So they're only seeing the people in their household. You're only seeing the people in your household, but you choose to make them your household.
Well, I think it comes down to their exposure or your family's exposure. We don't know who's going where. And like I said, 50% of the people could be asymptomatic and not even know it, especially the younger, population. So I think the risk is still there, even if the other family, we don't know, people are still going to work, right? So, I think I think your exposure is still high if we don't know who's going where.
Yeah. I mean, that makes sense. Does blood type determine the severity of symptoms if you're infected?
Nothing that I'm aware of in terms of that.
Yeah, I know we were hearing things, but I don't know if that was substantiated or not. Yeah. You guys can keep having the questions come. Just wanted to, we promised 30 minutes. It's we started at 7:10. It's 30 minutes. We don't want to overburden people. And inshallah, we're going to continue to do these kind of events every month. This was COVID. We have something else lined up. Look, if you register to this, we will send you more information that's going to be coming up next month and hopefully over the next year. If anyone's interested in helping us, in talking and anything like that, just message me or email us, info@mainlinemuslimsociety.org. And in the beginning, I forgot to mention our most important sponsors, ICNA Relief Shams Clinic, which is a beautiful clinic here that's helping so many people. They're actually even volunteered to help us give flu shot vaccines to our whole community if we had interest. Our community is still developing, so we kind of stayed away from that this time, but next year, inshallah, we'll definitely take them up on it. There is a poll. I don't know if you guys got it, but please do answer it. We want feedback. So that way we can continue to improve on the things that you guys value. Let's see if there's any other questions. Okay. All right, I think no other questions coming up. If there are any, you guys can just speak if you'd like to. Otherwise, thank you so much, Dr. Zia, for coming in and talking to us. And congratulations, he was just matched as an infectious disease fellow at the University of Massachusetts, which is a very hard thing. And I know it's stressful during this time. So we're very excited to have someone like you in the community helping us and guiding us.
No,
and of course,
it's been my absolute pleasure. And I just want to add one thing, that it's a bad disease. We've seen people who were on oxygen for 2-3 months, never ventilated, never on a ventilator. And you see the lung imaging after a couple of months, and they are so fibrotic where you can't even exchange oxygen between your blood vessels and between your lungs. And these people are going to get lung transplants. So please stay safe, follow precautions. And like we talked about the quarantine, I still say 14 days, but per CDC it's changed. So please be careful out there.
Yeah, may Allah protect us all. Jazakallah khair. And thank you, everyone. Thank you, Amri, he's a medical student from Jefferson who's kind of helped do all this. Inshallah, you'll see more of us as we continue. Amri, did you want to say anything else before we end?
Jazakallah everyone for coming on, and hopefully inshallah we can continue to do this monthly and benefit the community.
Inshallah. And you guys will get an email with that guide, inshallah, in the next 24 hours. We're gonna, with the new updates that Dr. Zia gave today, we're gonna edit it and send it out. Assalamu alaikum.